Heart failure (HF) is a clinical syndrome where the heart is unable to pump sufficient blood to meet the body's needs. It can result from structural or functional cardiac disorders affecting the heart's ability to fill with or eject blood. Causes: underlying causes, myocardial lesions, cardiomyopathy, myocarditis, myocardial infarction, valvular and endocardial lesions, endocarditis, congenital valvular disease, rheumatic heart disease or HD, pericardial lesions, pericarditis. Precipitating secondary causes: heart fails acronym H equals hypertension, E equals infective endocarditis equals anemia, R equals rheumatic fever, T equals thyrotoxicosis, F equals pregnancy, fetus equals arrhythmias, I equals infections, L equals lung problems, S equals stress. Smoking. Types of heart failure: acute versus chronic HF. Acute HF, sudden onset, often due to heart injury, for example, myocardial infarction. Chronic HF, long-term condition with progressive symptoms, left-sided versus right-sided HF. Left-sided HF, most common, blood backs up into the lungs, gives pulmonary congestion, fluid in lungs. Symptoms: dyspnea, orthopnea, paroxysmal nocturnal dyspnea, cough, tachycardia. Right-sided HF, blood backs up into the systemic circulation, gives peripheral edema. Symptoms: swelling in legs, abdomen, hepatomegaly, jugular vein distension. Classification of HF: New York Heart Association NYHA classification based on symptoms. Class 1, no symptoms with activity. Class 2, symptoms with ordinary exertion. Class 3, symptoms with minimal exertion. Class 4, symptoms at rest. American College of Cardiology ACC. AHA stages based on disease progression. Stage A, high risk for HF, but no heart disease or symptoms. Stage B, structural heart disease, but no symptoms. Stage C, structural heart disease with symptoms. Stage D, advanced HF requiring specialized treatment. Diagnosis of HF: history and physical examination. Echocardiogram (echo) determines heart size, function. Electrocardiogram (ECG) detects arrhythmias, ischemia. Chest X-ray shows heart size and pulmonary congestion. Management of HF: 1. Pharmacologic treatment. Diuretics reduce fluid overload, for example, furosemide, spironolactone. ACE inhibitors, for example, captopril. Lower blood pressure, reduce heart workload. Beta blockers, for example, propranolol. Slow heart rate, lower blood pressure. Vasodilators and cardiac glycosides, for example, digoxin, improve cardiac function. 2. Surgical and device-based treatment. Coronary bypass surgery for blocked arteries. Valve repair, replacement for valvular heart disease. Ventricular assist devices VA DIS, mechanical pumps for advanced HF. Heart transplant, last resort for severe cases. 3. Lifestyle management. Stop smoking, maintain healthy weight, regular exercise, low sodium diet, reduce stress, limit alcohol, fluid intake. 4. Patient self-management. MAWDS, medications, take as prescribed, avoid NSAIDs. Activity, stay active but avoid overexertion. Weight, monitor daily for fluid retention. Diet, limit sodium to 2-3 grams per day. Symptoms, report worsening symptoms immediately.